COVID-19 has temporarily closed the doors of their Mexican restaurant, but the work hasn't stopped for Susanna Penner and their daughter Tanya. They've been up since 5 a.m., cooking meals for migrant workers. They'll spend the next 2 hours dropping off food for 400 workers in the area. Tanya and Susanna are two of the few people allowed onto the farms during the outbreak. They're hearing the workers' worries. Many complain about the strict lockdowns imposed to control the spread of the disease.
So some of them are really worried what's going to happen. They feel like they have no rights, that everything has been taken away from them, that they're here. Like some of them feel like that they're prisoners.
Last week, the province started testing migrant workers at their farms, promising job protection for anyone who ends up in quarantine. But Ontario's plan doesn't cover undocumented workers, an open secret around town with hundreds, if not thousands, in the area. Farm laborers who aren't here on government permits, hired instead via temp agencies and fly-by-night recruiters who shuffle them from farm to farm, taking a big cut of their pay. Rogelio Muniz-Santos, a 24-year-old from Mexico, died after testing positive for COVID-19. He came to Canada on a tourist visa. This man worked with Rogelio in a greenhouse. We're calling him Juan to protect his identity because he too is undocumented. Their jobs were arranged by a Canadian recruiter, their wages paid in cash, their safety overlooked. We started to get sick, he says, all of us, but with different symptoms. We knew that we had the coronavirus. Some of their final days together were spent living in this motel in Leamington. Juan says no one came to check on them or offer them food and water. They abandoned me. They never gave me anything, he says. Same with Rogelio. They also abandoned him. Santiago Escobar is an advocate for migrant workers. He estimates that at least 2,000 farm laborers in Windsor-Essex lack the proper paperwork.
Undocumented workers are more vulnerable because they don't have status, so-called legal status. They don't have access to the healthcare system.
This undocumented man is from Guatemala. He came here on a temporary foreign worker permit, but when it expired, he stayed. We're protecting his identity because he's afraid he'll be deported. In the past month, he says he's worked at 4 or 5 different farms. Are you frightened that you might get sick?
No,
at the moment I'm not scared, thank God, because to me it doesn't exist so far, he says. Around 1,000 workers have tested positive on farms so far, but this number tells us little about the health of undocumented workers.
It is a different level of barriers for those who are not currently documented as workers here, and the biggest impediment there is they don't have OHIP coverage, and so their assumption is that this type of testing is not available to them.
Testing is available for everyone, but that message may not be getting through. Susanna and Tanya hear from undocumented workers, fearful not of COVID, but of coming forward.
They're scared that once they find out who they are and that they're not that they are undocumented, that they're going to get deported.
For many, it comes down to a choice between their own health and supporting family back home. There's always work to be done, often with few questions asked. Jonathan Gatehouse, CBC News, Leamington.